Steve Mitchell. I'm the medical director of the Washington Medical Coordination Center, which has been working closely with the Department of Health to help distribute patients throughout the state of Washington and deal with the COVID surge that we're experiencing with Delta. And I'm also the emergency department medical director at Harborview Medical Center in Seattle. And so hospitals throughout our state, as has been said, are full and at the highest levels of occupancy that our state have ever seen. Our hospitals, in particular, that provided advanced care where patients are transferred to, all of them are stretched and stressed and stretching their staffs in ways that we have never asked them to stretch before. And this means that for many patients, for long periods of time, they are waiting in emergency departments before getting a bed in the hospitals, especially in the community hospitals and regional hospitals that accept transfer patients. There are even patients now that are experiencing their entire hospital stay while still located in the emergency department. And this also leads to ambulances having to wait for longer periods of time before they can unload their patients into the emergency departments. And so those ambulances are not available to serve the public. And that forces the regional hospitals that normally accept these patients from small and critical access and rural facilities in our state. It's because of the load of patients in those regional hospitals, they're having to deal with those patients that are arriving in their emergency departments who are acutely ill, rather than focusing on bringing those transfer patients in from those smaller facilities. And so that is further straining the situation. And so that in turn is severely really impacting our small and critical access, our rural facilities, because the entire health system is built on providing care in these small hospitals for more minor issues, and they are meant to stabilize patients. And then for more critical illnesses, they are meant to transfer those patients to larger facilities that have the staff and the equipment and the specialists who can care for those acute illnesses. But sadly, for large periods of time now, we have reached a point where there are actually no critical care beds that are able to accept those patients throughout our entire state, as well as acute care beds available to serve those patients who need to be transferred. Put another way, there are long periods of time where we are just unable to move patients around our state to get access to the care that they need. A few examples of this have occurred in the past few days. There was a patient, for instance, who came into a hospital on the Washington coast with severe COVID illness and had to be emergently put onto a ventilator in order to save his life. And there was no ICU bed anywhere that our team could locate anywhere in the entire state of Washington. And it was actually a hospital in Idaho that was able to accept that patient after many hours of trying, and that's where the patient was transported to. There was another case of a lady who arrived at a very small critical access hospital on the eastern side of our state, whose prognosis was dire. However, our team at the Washington Medical Coordination Center tried for over 8 hours to find an ICU bed for this lady, this patient who was severely ill. And unfortunately, she actually did pass away in this small hospital when, after 8 hours of trying, we were unable to find an ICU bed that could help sustain her life at that point. And in the past several days, there was another example of a gentleman who was on the far eastern side of our state who had an overwhelming infection and needed emergent surgery in order to deal with that infection. And it took over 6 hours before we were even able to locate a bed for this patient, a hospital that could take him for emergency surgery. And then we still had to move him from the far eastern side of the state over into Western Washington so he could have his emergency surgery to hopefully save his life. And so this is occurring because every hospital in our state is short on staff, as has been said. We're talking about nurses and respiratory therapists and janitorial staff, really the lifeblood of our hospitals. And then although many many of our hospitals are short on beds. That staffing is really the critical aspect that is challenging everybody. And what's particularly difficult is that the number of COVID patients in our hospitals is doubling. But right now, as Dr. Lindquist implied, about every 18 or 19 days, and 95% of those patients are not vaccinated. We are at 1,462 patients right now in our hospitals who have confirmed COVID cases, and that's an all-time high for our state. And so put another way, we've added an additional 1,100 patients to our state hospitals just in the past 30 days. And so for reference, that's an equivalent of 4 Cadillac Medical Centers in Tri-Cities, or 5 Confluence Health hospitals in Wenatchee, or 5 Yakima Memorial hospitals in Yakima on the eastern side of our state that have been significantly impacted, or 3 Providence St. Peter's hospitals in Olympia, or where I work clinically, Harborview Medical Center. It's equivalent of 2 Harborview Medical Centers. And so I can't implore people strong enough for the need to get vaccinated and to do all the safety measures that are needed, because our hospitals and our health system are under more strain right now than we have ever been before.